Currently, there are 20,244 confirmed cases, 6,879 discharged, and 518 deaths. The National Association of Resident Doctors has suspended its indefinite strike, which commenced at midnight on Monday, June 15th. President of the union, Dr. Aliyu Sokomba, announced this in a news conference on Sunday following a meeting between the association and the Nigeria Governors Forum in Abuja. Sokomba noted that the decision to suspend the strike was taken in order to give the federal and state governments time to fulfill their outstanding demands. According to him, the suspend in the strike was taken in order to give the federal and state governments time to fulfill the outstanding demands following an appeal by the Speaker of House of Representatives, Secretary to the Government of the Federation, Chairman Nigeria Governors Forum, and other stakeholders. He announced that through the intervention of Speaker Femi Gbajabiamila, some of their demands had been met, including the provision of personal protective equipment in some hospitals and the inclusion of the Medical Residency Training Fund in the revised 2020 budget. The association will, over the next 4 weeks, await the fulfillment of the promises made by the governors to extend the implementation to the various states. He further stated that the chairman of Nigeria Governors Forum, Governor Kayode Fayemi, and the Director General of the State Tertiary Health Institution, Mr. Asizana Okauru, had promised to discuss with the governors of Kogi, Gombe, Lagos, Oyo, Osun, Ogun, Ondo, Kaduna, Nasarawa, Enugu, Anambra, Abia, and Imo states for immediate pay parity with the corrected comments of 2019 and the salary shortfalls. Anyhow, they also met with Governor Seyi Makinde of Oyo State, who also gave his words to favorably look into all challenges of our members in Lautech Teaching Hospital, Ogbomoso, with a view to abiding by the international standard, he said. The resident doctors had declared an indefinite strike starting on Monday, June 15th, following the expiration of a 14-day ultimatum given to the federal government to address several issues and demands. To ensure accountability in the expenditure of the COVID-19 funds, the Socio-Economic Rights and Accountability Project has sued Minister of Health Dr. Osage Heaniwe and Director General, Nigeria Center for Disease Control, Dr. Chikwe Iyekweazu. The Lagos-based rights group in the suit filed at an Abuja Federal High Court during the weekend sought an order for leave to apply for judicial review and an order of mandamus to direct and compel Heaniwe and the NCDC to publish details of the funds received from federal, state governments, private sector, and details of how the funds have been spent. The suit followed SERAP's Freedom of Information request dated March 27, 2020 to the Minister of Health and the NCDC, in which it expressed concern that lack of transparency in the use of the resources to contain COVID-19 will lead to mismanagement of the money, loss of lives, and damage the country's public health system. The Director General of the Nigerian Center for Disease Control, Dr. Chikwe Iyekweazu, has adjudged the Emergency Operating Center in Akwa Ibom State as the best in the country. Dr. Iyekweazu and officials of World Health Organization who were in the state on a walking tour of health facilities over the weekend commended the Akwa Ibom State government for its investment in healthcare and building institutional capacity to respond to the COVID-19 pandemic. They qualified the facilities in the State Emergency Operations Center as best in the country and medical facilities across the state as representing the future of healthcare in Nigeria. He expressed satisfaction over the state-of-the-art facilities and quality of personnel available in the state and assured that the federal government and the Presidential Task Force on COVID-19 will be pleased to deepen collaborations with the states. The NCDC boss extended the gratitude of the federal government and the Presidential Task Force on COVID-19 to people and government of Akwa Ibom State and thanked the health workers for their very hard work over the past few months of the outbreak. Speaking after inspecting the Akwa Ibom Specialist Hospital and the Emergency Operations Center, the Akwa Ibom Emergency Operations Center, Dr. Iyekweazu said this is actually a joint mission with the WHO coming to Akwa Ibom A has really been such an eye-opening experience, both at Ibom Specialty Hospital and this EOC that will be opened on the 23rd of June. I think we were jointly pleasantly surprised at the opportunity this presents to the country. This will probably be the best EOC in the whole country by the time it's fully operational. Lagos State Government, Mr. Babajide Sanwo-Olu, has approved the reconstitution of Lagos State Employment Trust Fund. A statement signed on behalf of the governor by his chief press secretary, Mr. Gboyega Akosile, explained that the new board appointments will take immediate effect when necessitated by the vacancies in the organization. The governor thanked the previous members of the board for their meritorious and conscientious service to the state. Governor Sanwo-Olu congratulated and thanked the new members for accepting to serve the state and help improve on the achievements of their predecessors. The new members, Sanwo-Olu said, were carefully chosen based on records of excellence in their chosen fields. Membership of LSETF board is a 4-year tenure, and the new board is chaired by Mrs. Bola Adeshola with Mrs. Abisoye Tejumola as the executive secretary. The Governing Council of the Standards Organization of Nigeria has approved the first ever Nigerian National Standardization Strategy 2020 to 2022. In a virtual meeting headed by the Permanent Secretary, Federal Ministry of Industry, Trade and Investment, Dr. Nasser Sani Guazo, said that the NNSS was developed by SON to identify priority areas to focus on based on national needs assessments. Sani Guazo said that the document was accompanied by a national implementation plan that gave orientation to the national standardization work within a 3-year duration. The NNSS, according to him, has identified a total of 658 standardization projects in key priority areas classified by economic sectors as highlighted in Federal Government's Economic Recovery Growth Plan, the Nigerian Industrial Revolution Plan, and other related national strategic plans. Sonny Guazo also described the establishment of the NNSS as outstanding and an epoch-making achievement. The Director General of SON, Mr. Osita Aboloma, enumerated the organization's support of the federal government's response to the COVID-19 pandemic. He said they include leveraging its international collaboration to make necessary and relevant international standards available to local manufacturers at no cost. Aboloma said that SON had also been providing necessary technical quality assurance support to local manufacturers involved in the manufacture of personal protective equipment required for the prevention and control of COVID-19 nationwide through its state offices. On the approval of 168 Nigerian electrical electronic products, 3 for civil building technology products, as well as the reviewed standard for hotel and service accommodation management system and rating, requirements and guidance for use. He also highlighted some of the standards to include review of standards for fertilizers, review of existing and development of new standards for the tomato and cassava value chains. The Minister of Finance, Budget and National Planning, Mrs. Zainab Ahmed, has canvassed the need to mobilize local savings, which she stated is capable of reflating the economy post-COVID-19. Ahmed spoke during the inauguration of the National Savings Strategy Working Group in Abuja, urged members of the group to develop easy instruments that are safe to be able to attract ordinary Nigerians to key into the strategy. The terms of reference of the group include to study the National Savings Strategy paper and advise the federal government on the feasibility of the proposals or with recommended changes, to advise on ways and means of mobilizing and channeling corporate and individual savings to accelerate domestic capital formation to support entrepreneurs and enterprise development in the urgent task of diversifying the economy and the deepening of the capital markets. The group is also expected to draft a national working paper that outlines a detailed roadmap on the implementation of the National Savings Scheme to be submitted for approval by the Federal Executive Council. According to Ahmed, let us not forget the average Nigerian that wants to save and does not have huge sums. We need to develop easy instruments that are safe to be able to attract them. Look at creating retail savings scheme to allow these Nigerians to save quickly by being able to enter and exit without unnecessary rigors. We need to mobilize local savings to reflate the economy, increase productivity by creating new enterprises, and ensure that existing ones also thrive. Ahmed commended the acting DG SEC, Hatim, and the members of the Capital Market Master Plan Implementation Council for their dedication and commitment to the implementation of the Nigerian Capital Market Master Plan so far. She expressed optimism that ongoing efforts to review the master plan to align the assumptions and projections with current realities would redefine the roadmap for stakeholder participation in the Nigerian capital market. My expectation when the review is concluded is that we would have a strategic document that provides a clear pathway that would enable the Nigeria's capital market achieve the goal to be Africa's deepest, most liquid and largest capital market, contributing not only to Nigeria's socio-economic development, but also serve as a global financial hub, offering opportunities to other parts of Africa. In her remarks, Acting Director General of the SEC, Ms. Mary Udok, said the SEC launched a 10-year capital market master plan in 2015, a market-wide strategic blueprint that had the buy-in of all stakeholders aimed at making the market deeper, vibrant, and more effective. Udok said the implementation of the initiatives in the 10-year master plan would transform the Nigerian market, facilitate the diversification of the economy, encourage savings, and create wealth. According to her, this will no doubt grow investors' confidence, improve the depth and breadth of the market in terms of product offerings, engender market integrity, and contribute to the country's economic growth. I'm glad to report that we have taken up the initiatives outlined in the master plan document in a systematic manner while engaging with the government and other critical stakeholders to successfully implement key initiatives while driving the execution of others. Udok disclosed that the need to establish a national savings strategy was outlined in the master plan as one of the key strategies to enhance capital formation by mobilizing domestic funds for investment to drive rapid economic growth. She said it envisaged the deliberate provision of risk capital as venture capital and private equity that are naira-based and more committed to the long-term prosperity of Nigeria, as well as create a buffer to the instability created by foreign investors. Also speaking, Chairman of the Working Group, Mr. Fola Adiola, said savings is one of the fundamentals of highly developed economies and pledged the readiness of the group to help drive the Nigeria economy. The Minister of Information and Culture, Lai Mohammed, has reiterated that COVID-19 is real, warning Nigerians not to get infected. According to the minister, many Nigerians are not following the government's guidelines for the control and prevention of the disease, stressing that the only way not to get infected is by obeying the protocol put in place by the Nigeria Center for Disease Control and the PTF. The minister lamented that many Nigerians are living in denial of the virus and that the only time the update of cases by the NCDC makes impact on them is when COVID-19 affects someone they know. Pray not to get to the hospital, pray not to get infected, and the only way you will not get infected is by listening to what the NCDC is saying, to what the PTF is saying, the minister warned. He added that we have repeated several times here, there is no known vaccine for COVID-19, no known medicine for COVID-19. Don't believe what anybody is telling you. Lai Mohammed restated that the only known vaccine for COVID-19 is following the guidelines rolled out by the NCDC and the PTF, such as the use of sanitizers, local social distancing, washing of hands, and avoiding mass gatherings, amongst others. There is no other medicine than this, he explained, warning that if you know the experiences of those who have gone through this, who are going through this, you wouldn't pray never to be infected with COVID-19. As part of measures to fight the pandemic, he said the Ministry of Information and Culture will be doing more advocacy to enlighten Nigeria about the pandemic and how they can prevent and control its spread. The Presidential Task Force on COVID-19 pandemic has said that the Federal Capital Territory, Abuja, remains one of the hotspots where community spread of the virus is prevalent. The chairman of PTF and secretary to the government of the Federation, Boss Mustapha, made this known on Friday while receiving a donation of personal protective equipment worth 10 million naira from Rotary District 9125. Mr. Mustapha was represented by the Permanent Secretary General Services Offices, Olusegun Adekunle. He said that 20 local government areas currently contributed 60% of the COVID-19 cases in the country. The PTF chairman listed the affected areas to include Mainland, Abuja Municipal, Mushin, Etiosa, Sabauni, Katsina, Alimosho, Maiduguri, Kosofe, and Dutse. Others were Ikeja, Nasarawa, Oshodi, Solo, Apapa, Amuwodofi, Oredo, Bauchi, Lagos Island, Surulere, and Ado-Odo Ota. Mr. Mustapha blamed the rising community spread of the pandemic to poor level of compliance with the precautionary measures at the community level. He therefore appealed to the group led by its governor, Victor Onuguga, to take the COVID-19 pandemic awareness campaign to the communities. We want to sanitize Nigerians on the dangers of this development, he said. We urge Rotary to help us take the awareness further. The risk management team is available to share strategy with the organization. The SGF further warned that the ravaging effect of COVID-19 pandemic was there for everyone to see, including the impact on both governance and the economy. It is for us to strategize for a new way of life. A good number of staff have not been at work for the past 4 months. The impact of this on the economy is glaring. Europeans are enjoying the gradual easing of coronavirus lockdown measures, but in hospitals they are already preparing for the next wave of infections. Some intensive care specialists are trying to hire more permanent staff. Others want to create a reservist army of medical professionals ready to be deployed wherever needed to work in wards with seriously ill patients. European countries have been giving medics crash courses on how to deal with COVID-19 patients and are now looking at ways to retrain staff to avoid shortages of key workers if there is a second wave of the novel coronavirus. We need a healthcare army, said Maurizio Sassoni, President-elect of the European Society of Intensive Care Medicine, which brings together medics from around the world who work in wards with extremely ill patients. Sassoni, who heads the intensive care department at the Humanitas Hospital in Milan, says medical staff need to be more flexible in the work they do and more mobile. If there is another big wave, we should be prepared to deploy doctors and nurses from nearby regions within Italy. This did not happen a lot in the first wave, he told Reuters. Many countries were caught unprepared by the COVID-19 pandemic in March and April, and hastily retrained medics to work with patients with severe cases of the disease to ramp up numbers and replace those who fell sick. Some sent medical students and retired doctors to help out in intensive care wards as hospital staff were overwhelmed. Those worst hit by the pandemic had to provide more beds and essential equipment for acute care units, and some built new hospitals. But problems and shortages persist. Italy, for example, may need to boost by 50% the number of anesthetists, resuscitation experts, and other medics it has working in intensive care, according to the Italian Society of Intensive Care. International music and film stars will headline a globally televised and streamed fundraising concert on Saturday to help fight COVID-19 as part of a joint initiative by the advocacy group Global Citizen and the European Commission. The initiative, called Global Goal Unite for Our Future, is aiming to raise billions of dollars in private and public donations to help lessen the impacts of the pandemic on marginalized communities. Speaking at an online panel ahead of the event, pop star Miley Cyrus said the pandemic was hitting the world's poor and marginalized people the hardest. She urged donors committing funds for tests, treatments and vaccines to ensure they're developed in ways that everyone everywhere has access to them. Researchers and drug makers across the globe are working on more than 100 potential vaccines against COVID-19, which has so far killed more than 463,000 people. Hosted by actor Dwayne "The Rock" Johnson, the virtual concert will feature Sirius Chloe, Haley, Christine and the Queens, Coldplay and Sakura, amongst others, and include actors Charlize Theron and Hugh Jackman, as well as retired soccer star David Beckham. We need our world leaders to commit the billions of dollars needed to develop and equitably deliver testing, treatments and vaccines, said Hugh Evans, Global Citizens Chief Executive. And that'll be all for this edition of The Human Angle. You can send your videos and pictures to news@polshareng.com or programs@polshareng.com, and let's share your experience and views. Visit our website www.polshareng.com to get more updates from our news stories and videos. Also follow our social media platforms showing on the screen for further updates on our market reports. Till tomorrow, thank you for watching and please keep staying safe.